Good morning. It is Tuesday, October 26th. We are live here inside the Dolph Simons Jr. Family Broadcast Studio. Welcome to the Morning Medical Update. Thank you for joining us on both Facebook and YouTube this morning. Colder temperatures outside mean more gatherings inside, which can mean a possible spike in COVID cases. It is a growing concern here and elsewhere. Our guest today, Dr. Amber Schmidtke, she has a blog. She runs the numbers, helps us break down what we're seeing in one area in particular and then kind of what it could mean for us here. So we'll talk more about that. So glad you're here in person with us today.
Thank you. It's a pleasure to be
Yeah,
here.
you joined us virtually, but I like you right here next to me. Also over here next to me is Dr. Dana Hawkinson joining us with our COVID count. Good morning to you.
Hi, good morning. Well, today we have 21 active infections, with 9 of those in the ICU and 4 on the ventilator. We still have 25 in that recovery period, so 46 patients. Our numbers are really holding steady right now. We would certainly like those hospitalized numbers to go down. And Hayes has 14 active infections and 5 in that recovery period as well. So they've actually seen a little bit of an increase.
All right, thanks for the update. Do we have reporters on the line today? No
Good morning, guys.
reporters.
Taylor Henderson, KSHP.
Hey, Taylor.
Taylor.
Good morning.
You got that quick trigger. I was ready for you to throw me off there real
I
quick.
know, you got to go fast. I'm sorry. I know.
Yeah, I always like to see if anyone else wants to go first before I jump in there. I know we've talked about this before, but one thing I wanted to ask about, just for the latest clarification, because it involves a story I'm working on right now. Dr. Hawkinson, can you talk again about the differences between so-called natural immunity and the vaccine once someone who has had COVID and recovered from it? Talk about the differences between the strength of the vaccine to help that person versus so-called natural immunity.
Yeah, so natural immunity before Delta, we certainly saw that reinfection was rare. After somebody was infected, what would happen with reinfection? We had cases that some people would do much better and have hardly any symptoms. We also saw some cases where people would do worse. So I think it is really, again, rolling the dice. We don't exactly know what will happen on repeat infection. More than likely, you should still have immunity and recover well. But what we are seeing with vaccination, especially those people that are getting vaccinated after being infected, certainly in the benchtop, in the basic science, we see that those people's immune system are better, have a better breadth or wide range of neutralizing antibodies to new variants or variants that they haven't seen in the past, as compared to those people that just had natural infection itself, or convalescent people, as we would say. So I think we do have good basic science research showing that those people that get at least one dose of vaccine after infection, their immune system is able to expand and evolve a little bit better to develop more or different neutralizing antibodies to new variants that their body hasn't seen before, and more than likely variants that we haven't even identified yet. So right now we see that both natural infection does have some durable immunity, but what we see is vaccination also has significantly durable immunity, but also probably the added benefit of the wider breadth of that immune response to identify and tackle variants that may be circulating, variants that we know about, but even other variants that we don't know about. So I think that continues to remain to be seen, but certainly we know Delta overall is really the main dominant variant now around the world. We've seen some other ones that have peaked up, but really nothing has outcompeted the Delta variant in any geographic region it's gotten into. So I don't know if that helps answer your question.
It does. And then one second question as we get ready for kids with vaccines, that kind of thing. Are there any childhood diseases, childhood sicknesses, that kind of thing, things that are more prevalent in kids anyway, that would keep a child in that 5 to 11 age group from being able to get the vaccine, whether it's something they have not had yet or something that they were born with, that kind of thing? Is there anything that would keep a younger child from being able to get the vaccine that we know of right now?
Not that I'm aware of. In general, there are very few really significant contraindications or absolute contraindications to getting these vaccines. Again, there's no preservatives. They are not whole virus or live virus. They really are just pieces of that spike protein. So I think that there's really no specific or absolute contraindication to being to not being able to get those vaccines. So I think it should be really safe for every child. But again, I think if there's questions, certainly talk with your pediatrician. But from what we have seen, the safety profile of these vaccines in the trials are very good, and there really shouldn't be any or too many specific medical absolute contraindications to getting these vaccines. And the other point to your first question too is based on infection and vaccination, we know and we have seen what has happened with just natural infection itself. Although most people will recover and not need to seek medical attention, very small percentage will have to go to the hospital, a very small percentage will die. But unfortunately, when you have masses of people infected, those small percentages can equal huge, huge numbers. And that's what we have seen with the excess deaths that have been present around the world because of COVID-19, the excess deaths in the United States, and just the overall mortality, the complications, the long-term complications, and all of those aspects as well.
Thank you.
Other questions?
Yep.
Other questions on the line? Okay, we're good. Hey, Dr. Hawkinson, I do have a question for you, though, if you can just help me understand what this means, because we saw this with Pfizer a couple of weeks ago, but now Moderna is saying that its vaccine is now safe for kids 6 to 11. First, why 6 to 11 and not 5 to 11? Maybe help me understand that, and that they are going to now submit that to the FDA, those findings. Just kind of walk us through what that means.
Yeah, again, this is the company reporting these. We certainly will look forward to the publicly available data. We know that data is available for the Pfizer vaccine. We had seen it in the past with the Pfizer and the adult as well. So that will become publicly available. Why is it 6 to 11 instead of 5 to 11? That is probably how the study was drawn up, or they maybe didn't get enough people in that 5-year age group. Is that really significant? I think it is significant on paper, and when you look to authorize or approve these vaccines, but overall, as far as the children and their immunological age, 5 versus 6, I don't think there's a big difference. That's more of a administrative and business, and just making sure that they have that data to say we have enough people to evaluate benefits, safety, and any adverse events as well.
Okay, that makes sense. Okay, so we're going to get to some community questions here in just a little bit, so go ahead and start sending those in. You can send them to us via YouTube, Facebook, Twitter, and of course you can email those into the Medical News Network at kumc.edu. So get those in, and we will get to those here in just a moment. But let's turn to our guest, Dr. Amber Schmidtke, Chair of Natural Sciences and Mathematics at the University of St. Mary's in Leavenworth, and we are so glad that you are joining us today. First of all, I want to talk, before we get started with some of the questions I have, but tell everyone a little bit about your blog and how that started. You had been doing some other social media outreach before COVID hit, and then you must have seen a need, and now you got up to 30,000 people that are engaged with your blog. Tell us a little bit about that.
Yeah, so I started just like anybody else, probably Dr. Hawkinson had this issue too. When the pandemic started, I had a lot of friends and family who were just scared and confused and asking questions to whatever expert they could find. And at that moment, it was me. And so I started sharing what I knew on social media, and it gained a really fast following, not just among my friends and family, but on my professional scientific page too. And so over time, I decided that, since not everybody's on social media, perhaps a newsletter made the most sense. So I transitioned to a platform called Substack, which sends that newsletter. It used to be multiple times a week. Now it's just once a week because I have a real job too. And so that's how the newsletter has really taken off. So that's been since July of 2020. But I've been in the thick of the COVID data since the very beginning.
Right. So I was going to say, you put this out, but I bet those text messages still come through to your phone asking questions all the time, right?
Absolutely. All the time, from family, from friends, from reporters. I get them from everywhere.
But you must have been glad. It must have been nice to know that you were a place that people could turn to. I know you're just one woman, but you were a place that people could go and get some good, solid answers, good information.
Yes, it's a big honor. And to be honest, I think everybody during this time just wants to be able to help in whatever way they can. And this was the role that I could fill.
Well, you certainly are. Okay, I also want to, we talk a lot about Georgia with you, and there's a reason why. You used to teach at Mercer University School of Medicine and microbiology and immunology in that department. I always say you're smart, you know your stuff. That's why I'm so glad you're sitting here with me, that's for sure. One headline out of Georgia this week is rural COVID-19 deaths, now double that in the rural areas. Why is that? What's being done to combat this? Tell us more.
Sure. So if we can take a look at my first slide that I brought with me, what it shows is kind of how the pandemic has gone for Georgia since it began. And what you can see is that yellow line is the rural counties in Georgia. And so every spike that we've seen in COVID cases and COVID deaths has hit rural Georgia particularly hard. And so now we're at a situation, if you look on the left, you can see that the death rate, the cumulative death rate for rural counties is more than twice as high as in the metro Atlanta area. So why this is happening? We have a couple things. There's already been a big rural versus urban divide in access to health care. That's something that's consistent here in Kansas as well. But, because of that, we also have some big variation in social determinants of health. So people aren't necessarily taking care of their health on a regular basis, and then something like COVID comes in. We've had a lot of rural hospitals close down in recent years, and so really it's just sort of a hot mess, to borrow a Southern term, of just the perfect storm. And then you add things like vaccine hesitancy and vaccine access barriers, and it's really just a recipe for horrible things.
Yeah, hot mess. That's something we can all understand. That breaks it down. And it's so interesting because when I hear you talking about this, it goes to show just those small little variables that can make the biggest difference and really tip the scales one way or another. Hospitalizations due to COVID-19 are decreasing in places like Georgia, but they're on the rise in places like the Dakotas. Explain that.
Yeah, so my next slide may help with this one too. But yes, you're right. So thankfully, the Delta wave has receded in the state of Georgia, and we're very happy to see that. On the slide that I'm showing you here, you've got the map of the United States broken down into the way that the Federal Emergency Management Agency breaks down the country. And on the bottom right, what you can see is where are hospital admissions starting to rise. And where we're seeing that happen, especially, is in Hospital Region 8, which is the Mountain West. So that is going to be like Montana, Colorado, Wyoming, the Dakotas. And so, as much as last year's winter wave really kind of started in that area, it's back. It's coming back. And so we'll have to really keep an eye on what happens there. What I will say is please learn the lessons from the South about what we saw and take this pandemic seriously. We are not quite out of the woods yet.
We're not there yet. I want to pull up the heat map. That's something I think that all of us can understand. It gives a big scope here because I want to understand when you talk about Georgia, does that help us understand where we're going or where we've been or where we could go back to?
A little bit of all of those things. And the reason why is because, in the South, we have very mild winters, very comfortable springs and falls, but summer is our hot time. And so if we're going to gather indoors, that's during the summertime. And that's why you see the summer surges happening in Georgia in the summer. But here in the Midwest, here in the Mountain West and other parts of the country, we tend to gather indoors when it's cold outside. And we are heading into that season now. In fact, it's a little chilly this morning in Kansas City. And so, as we head into the holidays, as we head into the winter months, please take this as a precautionary tale that we may be seeing a rise in cases and hospitalizations and unfortunately deaths, especially in areas that have low vaccination rates.
So you mentioned the low vaccination rates. We're definitely not where we want to be, but a question we get a lot is those big concerns about now it's starting to get colder. We're starting to head indoors. We have the holidays coming on our heels right now. What kind of concerns do you have about that?
So I think the big thing here is to just try to make really good decisions. A lot of the tools that we've already identified that work in preventing COVID-19 still work. We know that we need to be adopting a multi-layered strategy for disease mitigation. So that could include vaccination. It should involve wearing a mask, limiting your exposures to others. For my family, for example, when we gather with the grandparents, we make sure to take one of those at-home COVID tests before we leave the house. The very last thing we want to do is bring a breakthrough case to grandma and grandpa. You know what I mean? And so they've made it through this pandemic this far, and we're not going to lose them now. But what I'm really excited for is what's going to happen this week, hopefully, when the vaccines for kids are considered and hopefully approved.
Well, we're going to be talking more to you about that for sure. So what activities do you think are the riskiest right now?
So I think anything where you're inside with a crowd and you're not able to maintain distancing.
And you don't know who's vaccinated.
Exactly. So that's the hard thing is when you're in a mixed setting and you don't know everybody's vaccination history, it's important to remember that you're effectively buying the risk of everybody that you're there with. So whatever exposures they've had, you now have. And so sometimes it helps to put it in that perspective. If you wouldn't take those risks, are you comfortable with somebody that's within 6 feet of you taking those risks?
And what are we seeing as far as people letting their guard down? I mean, we think it was so risky a year ago. We've made strides. We have a vaccine. The kids are going to be vaccinated soon. What are you seeing as far as that being a variable, people letting their guard down when you start to put that data together?
Oh, for sure. I mean, I think that what we have seen in Georgia in particular, and my last slide will help with that too, is that it was sort of a perfect storm of pandemic fatigue, some confusing guidance regarding masks. And this all happened around this, and also this sort of misperception that COVID can't hurt kids. And all of these things sort of happened at the same time that Delta arrived. And so when adults in Georgia lifted the barriers, who Delta hit hardest was kids. And so on the graph on the left, what you can see is what was going on with pediatric or all age group cases a year ago in 2020. And on the bottom is what's going on this year around the same 8-week period of time. And the big thing you notice, of course, is there's more cases. But in addition, look at what happened with kids. They weren't even an issue last year, but this year they actually lead cases compared to all other age groups. On the right-hand side, what you can see is that for 5 to 10-year-olds, their case rate rose by 1,200% in the span of a year. So Delta was here for kids, unfortunately, and not just because, not to say that it goes specifically after kids, but they are the largest group of people who remain unvaccinated.
Well, and what I hear you saying is that so when they lessen those restrictions, and again, that's assuming everyone's vaccinated as an adult, which we know that wasn't happening.
Sure.
So then it was the trickle down effect to the children. Had every adult been vaccinated, it would have looked different. But you don't have all these adults vaccinated, and so it's going to trickle down to the unvaccinated.
Yeah, so to speak of Georgia in particular, just yesterday they reached 50% of the population fully vaccinated. So they're still quite low compared to the goal line.
So how does this all relate to what we're seeing here in our area? What are your predictions and thoughts about what's coming down the road for us?
So last year when we saw COVID really take off was right around Thanksgiving and heading into Christmas. But really November was hard for Kansas. Mm-hmm. And so my hope is that if we can make it through November and not see that similar spike, we may be in the clear. But what I'm cautious about is that there are pockets of Kansas that still have very low vaccination rates and have very high test positivity rates. And so when those things combine, what I worry about is that cases will take hold and we will not have the testing infrastructure in place to properly monitor and track where those cases are.
Makes sense. How do you think we get more people vaccinated? Are you surprised that we're not seeing higher vaccination rates? I think when we thought vaccines here, everyone's going to flood out and get it, boom, we're all vaccinated, moving on. And that hasn't been the case. How do we get there?
Oh, that's a good question. I mean, I think that's the question that a lot of people in public health are struggling with right now is how do we get across the finish line? We have the tools to stop this pandemic. We're unfortunately just not using them as a society, not effectively anyway. And so I agree. It has been one of the biggest disappointments of this pandemic, honestly, is to have this life-saving technology and have people not taking advantage of it. But, we just keep working. We try to remove as many barriers as we can for people that are struggling to gain access to the vaccine. We continue to have those conversations with people who are hesitant, understanding that this is a rapport building exercise, right? We need to build trust with people. This is a personal decision that they're having to make. It's a medical decision. And not everybody has access to a primary care physician. And so it's important for us to have those conversations early, often, and as many times as we need to.
So let's talk kids. That's a big topic as they start to get vaccinated here in the next few weeks. That's going to be good news. But how do you think what kind of effect is that going to have? Again, with your crystal ball and your predictions, tell us what you're expecting to see, what you hope to see. How will this tip the scale one way or another?
Sure. Well, first, I will just start by saying I am here for it. Like, I will be pulling my son out of school. We will be going to get him vaccinated the very second that I have an appointment.
How old is your son?
He is 10.
Okay.
My 12-year-old was vaccinated on his birthday because...
Oh, we talked about that.
Yeah.
That was his birthday present. That was awesome.
Sorry, son, but you get a life-saving technology for your birthday.
I think that's great.
So the 10-year-old will be getting it too. So that's me. And I'm encouraging every parent that I know to do this. I would never recommend something for you that I wouldn't recommend for my own son. And I'm very excited for this because you know what this means? This means going back to normal, especially in the school setting. So many of us depend on those schools for our children's education, but also for our ability to go to work. And so we have had so much upheaval over the last 22 months. It's time to close the door on some of this, right? And so the way we get there is through this vaccination. And so that's what I'm really hoping, is that we're going to see great uptake with parents to get their kids vaccinated. I hope they're as excited as I am.
Right. So I was going to say, some parents give it as a birthday gift. Other parents were having to cut, it's like pulling teeth to get their kids out there. So I've told my kids are actually getting vaccinated on this show.
Oh, cool.
That went over really well, let me tell you. So
it's a lot of pressure.
It is, but it's going to happen. Like you said, it's like a historical moment, I think, and especially when you do in the field that you're in, to have your kids be part of something and leading the way and setting the example, I think is important. Okay, we're going to jump into some questions, okay? Dr. Hawkinson, I've got a few for you, but I'll get you back in here. Donna wants to know, are there any preservatives in the vaccine?
No. Again, all of the components are on the FDA briefs for Moderna and Pfizer. I think there's 9 or 10 components in each of those, but it clearly does say there is no preservatives in the vaccine.
Okay, Jackie wants to know, when will there be any information about an acceptable level of antibodies to prove immunity, or whether or not you'll need a booster shot?
Yeah. I mean, I think that's good. The correlate of immunity is what we're looking for, the correlate of protection. What level is that? Is that a certain number of antibodies? But again, remember, our natural immune process is we see an antigen, we see a pathogen, our antibody levels spike up, they get to a maximum, and then over time they decrease and wane. That's the natural history of what happens during an infection and an immune response. So I think just trying to track antibodies and follow antibodies is not the right answer. We also remember that you have this response that when you see that infection again, those B cells are recruited very quickly. Those T cells are recruited very quickly. So your antibody levels start to increase and jump up within a matter of days as compared to when you first saw the infection. So it's not just about the level or the number of antibodies, although a lot of times we make that correlation, but we go back and forth. But we do understand that there is that other larger component or other component of the immune system, and it's not just the B cells and antibodies, but it's the T cells as well. So, but to answer the question, we are still looking for that answer. What is the correlate of protection? Is it a certain antibody number? Is it a certain neutralizing antibody? We don't have that answer yet, but what we have seen, even months out from first vaccination, you still have excellent protection for the most part, for most people, against hospitalization, severe disease, and death as well.
Dr. Schmidtke, Catherine read an article yesterday out of Wichita saying that Kansas is close to reaching herd immunity, according to doctors in this article. Is that true?
Not to my knowledge, it's not. So herd immunity can be achieved through both vaccination as well as natural immunity, as Dr. Hawkinson has said. And we're getting close to what was the theoretical herd immunity threshold. But with Delta, it really changes the game. I think that because it is so much more transmissible, what we may have thought of as herd immunity at 80% probably needs to be closer to 90, 95%. And in order for us to see a situation where we don't see these big runs on hospitalizations and we don't see these big impacts on the community.
So herd immunity is a response from 80 to 90 people, or just 80 to 90 people vaccinated? More specifically, what does the herd immunity mean?
So what herd immunity is a term that we borrow from the veterinary field, which is the idea that, by vaccinating enough of a cattle herd, for example, those who we missed, who maybe couldn't be vaccinated, are sheltered by those people who are vaccinated or protected through natural immunity. And so in a situation like this, what we're talking about is we need to reach a level where 85 to 90% of the population is functionally immune, whether that's through vaccination or natural immunity, in order to see that protection for those who can't be vaccinated because maybe they're allergic to a component, they can't be vaccinated, they're immunocompromised, so they don't mount a proper immune response. There's a few different populations we want to make sure we're still looking out for and taking care of.
Yeah, and I think the other component to that is, I would agree exactly with what she said. The other component to that is, just like in vaccine effectiveness, we have to define what are we talking about with herd immunity. So people say, well, the vaccine's only 20% effective right now. I think we have to define what are we talking about in vaccine effectiveness, and that is it just blocking you or protecting you from having any positive PCR test? Is it protecting you from having symptoms, or is it protecting you from going to the hospital? And what these vaccines are for is protect you from going to the hospital and going to the ICU and dying. And so I think when we talk about herd immunity, we also have to ask that same question. Is it just from you testing positive for the infection? Because again, we're not as worried about that infection. People have colds and influenza all the time. We aren't worried about the influenza, the infection itself. What we're concerned about is the mass number of people that are infected, that have no immunity, that come to the hospital, that suffer severe disease, having to go to the ICU, have to be on the ventilator, and of course, dying. So I think that's an important thing to remember too. What are we really discussing when we're talking about herd immunity? Are we talking about blocking all infections so nobody gets infected? Or are we really trying to stop those most severe forms of the disease that make you go to the hospital, go to the ICU, get on the ventilator, and maybe never come off? And then also, even if you do come off, are you suffering those chronic long-term effects of long COVID as well? So I think we have to really define what are we looking at when we're talking about herd immunity. And for the most part, what we are really trying to do, and why we are so adamant on pushing and endorsing that message of vaccination, is because we know how we can protect you and how you can be protected individually, but also in your bubble and in your community from going to the hospital, going to the ICU, and of course dying, and that is through vaccination.
Kristen wants to know, what do you recommend for children who will be turning 12 in the next few weeks? Do you get the smaller dose immediately when it becomes available, or do you go ahead and wait a few weeks until they turn 12 to get the full adult dose? So if you get that immediate dose and the smaller child dose, and then the second shot is after you turn 12, is that the second shot? Is it the smaller dose, or will it then be the larger dose? So I think she has a child that turns 12 in December. Just what do you do? Wait, get it immediately.
Yeah, I mean, I think this will go down to really what you feel. So again, we do have the holidays coming up. We know also the cold weather is coming up. If you can, I don't think we anticipate the child, the 5 to 11 vaccine being available until that first or maybe second week of November, so that kind of pushes you out. If you're talking about December, if you're talking early December, I think it's certainly reasonable to wait for that full dose. But also, are you going to be traveling for Christmas? Are you going to be meeting with people for holidays, gathering, things of that nature? How about the New Year and things of that nature as well? So if that is the case, then you probably want to go ahead and get vaccination as soon as it's available.
I'm sure you get a bunch.
Start that protection.
Right. Well, that's right. I'm sure you get a lot of those questions, kind of people who are on the line. We've got the holidays coming. Do you wait? Do you go? What are you advising people that ask you?
Well, of course, I always recommend that people speak with their pediatrician. They're the people that are going to know best for your child and their unique medical needs. If it were me in my position, I would wait and get the 12-year-old dose, just because that's the dose that's intended for them. But like Dr. Hawkinson said, there's not a lot different between an 11-year-old just 2 weeks shy of their 12th birthday and a 12-year-old. So, it's really 6 or half dozen of the other. What I will say, just to tag on to what Dr. Hawkinson was saying, was I was supposed to go to Hawaii with my family for Labor Day week, that whole week. But we postponed that trip because the pediatric vaccines were delayed. We booked that trip in March when we thought that the vaccines surely would be available by then, and they weren't. And so now we're going for the week of Christmas. And so that is another one of the reasons why we are making sure that our son gets vaccinated at the earliest opportunity, is because we want him to be at 2 weeks post second dose by the time we get on that airplane.
It's kind of going back to your point, which is just, it's about making good decisions. Like you said, you'd made a decision, everybody would be vaccinated when they went on that trip. They're not, so we're going to put it off.
Yeah, it was a really hard decision, but even the governor of Hawaii at that point was saying, please don't come. Not to me personally, but they don't have neighboring states that they could send patients to for ICU beds. So it was really, it was a hard decision, but at the same time, an easy decision.
Yeah.
And I hate to sound like everybody's mom here, but it really is the truth. Like, just make good decisions.
That's okay. You could be the mom. I like it. Okay, Phyllis says, I have a mild case of tinnitus, which seems to be related to the Moderna vaccine second shot. I'm wondering if I should take the Moderna booster or the J&J, since it's different. Any thoughts on that?
Yeah, I mean, I would try to speak with an ENT or an audiologist. Is it truly associated with that second dose? It's really hard to say. Obviously, you believe it is. So again, I think getting an adequate evaluation, but then also, now what they have allowed for is certainly mix and matching. I think it would be better to stay with that platform, the mRNA platform. But if you have concerns about it, that is one of the reasons why they allowed for people to mix and match, and certainly would say that I think getting a Johnson & Johnson is going to be better than not getting anything.
Carla has a question. It's been in several news articles. Vaccine makers are going to adjust soon. They're going to adjust the vaccine soon for the variants. If this is true, why get a booster now instead of just waiting? If we get a booster, won't that keep us from being able to get the new variant booster? Are they changing it?
Yeah, I haven't seen those news reports. We know that they are trying to stay ahead and being proactive against possible new variants, but the nice thing, I think the best thing that we have seen is that all these vaccines continue to have great protection against all of the variants that we have identified so far. And that is because, number one, of the conserved areas on the spike that don't change. But it's also because when we do get these vaccines, just as I stated before, if you've had infection and then get at least one dose of these vaccines, we've seen that these vaccines do help induce further expansion and evolution of your B cells and antibodies that are produced. So I haven't seen any information that they're actively starting to market these or looking to market them, but certainly they are trying to be proactive in staying ahead of the virus as much as possible. But right now, I don't believe there's any plans to change or pivot to a different vaccine formulation.
A question came in from Scott. Do you think that we're able to reach herd immunity until everyone is able to get a vaccine, so those 5 and under?
Yeah, so I think it's a great question, Scott. Thank you. And this is something that keeps me up at night, is how do we get there without vaccinating a really big part of our population? Kids make up as much as 18 to 20% of the population in Georgia. So you don't get to those numbers without vaccinating them, right? And so I think, it's going to start much like the vaccine campaign did for adults, where we're going to try as many carrots as we can to get people, to incentivize them to get vaccinated. We're going to see a big rush with those parents who have been waiting months and over a year to get their child vaccinated. That will be who comes in first. And then it's going to be the long game of how do we convince 1 or 2 families at a time to get those vaccinations done.
Yeah, 1 vaccine at a time. It's encouraging, though, when I hear we get that question so much, probably every day, a couple times a day, that when do you think it's going to be approved? When do you think it's going to be approved? Which makes me feel like there are parents out there ready to wait in line and get their kids vaccinated. So that's encouraging to know. Kathy wants to know, have you seen many more side effects for people who switched to a different booster? Dr. Hawkinson, any side effects from people doing the mix and match?
Not that I have seen, not anything over and above what we know that you would be getting with any of those vaccines individually. So I think, again, the safety profiles continue to be very, very good.
A couple more questions. Cheryl, she's 66 years old. She had COVID in September. She says she's fully vaccinated. 7 months later, got COVID. Should I get the booster now or wait a few months?
Again, the guidance is there's no minimum time between infection and vaccination. If you got vaccinated and then now most recently got infected, you were probably infected with the Delta variant. I think you can get it anytime you want. Again, if you are planning to be doing things, gathering, traveling, things of that nature, you can maybe plan for that. There's really no specific guidance on when you should get an additional dose or booster vaccination. So you could go at any point in time right now and kind of just see what is best for you and your schedule and any kind of soon future plans that you might have. And you may want to arrange it around that time.
So Isaac makes mention, of course, that Georgia and just the South in general, they love their college football. We know that. So the season started when Delta was in its peak. Seemingly, it looks like these football crowds haven't been a big issue. Of course, that's outside. Now we talk about basketball. We love our basketball. What do you think that's going to produce as far as numbers? Any concerns there?
Yeah, it was really surprising to a lot of people to see these great big crowds at the football games and not see a big spike on COVID cases. And I think the benefit there is that it is outside. And so we do have that great ventilation in that case where the viral particles, when they come out of your body, are able to really dissipate through the air before hitting somebody close by. So, right, it doesn't, in a way, it almost doesn't make sense based on what we've talked about, but it also does when you think about that idea of outdoors is safer than indoors. I am concerned about what happens when basketball season gets going. I know I'm ready to cheer for basketball too. I'm a big sports fan. And so the question is, how do we do that safely in an indoor arena? And so I think that, again, it's going to be really important to get vaccinated if you can, wear your mask whenever you're not eating or drinking, and keep those mask off periods as brief as you can. This is something we've had to talk a lot about with my son, like when you're at daycare, when you're at school, take the mask off to do the things you need to do, but don't dilly-dally about it, right? Put it back on because that really is your protection to maintain as much of a normal life as you can.
So how many, you've got 3 kids or 2?
2.
Okay, so what are their ages again?
They're 12 and 10.
Okay, so yeah, so you are you kind of momming it every day, reminding them? Do you have to remind them, how to do it right, or they've got this down?
So I will say that the 10-year-old did virtual learning last year at home, and I was doing my science communication thing at home, and so he was sitting 12 feet away from me as I was doing interviews with people like you, and so he is a little mini epidemiologist, and so for the most part, he knows what he's doing, right? And there's just little reminders that we have to have here and there.
Well, because he's a kiddo, right?
Yeah.
That
and
happens.
so, you have to be careful because I would sometimes be talked to about pediatric deaths and things. And so you have to be careful about what you say, of course, and not, put excess fear in his heart. But yeah, I mean, he's fully aware of what's going on with the pandemic and just as ready as any of us for it to be over.
Were you impressed with how schools have handled this past year?
Yes. I felt really confident sending my son to school in person this year because of how well they handled it last year. So the school where he attends has a mask required policy, and they've still have a lot of the same protections in place that they did last year. So I feel very confident about that.
I have a question for you. What do you think the disconnect is between people like yourself, these smart people, these scientists and researchers and doctors, and what they're sharing with the general public, and then kind of what the public is actually interpreting, and kind of why it's so difficult to get through to certain people? Some people just need more information and they're taking it in, and then some people just resist. But what do you think that disconnect is?
Right. And I think this has been a thing that public health was not ready for, and medical science was not ready for, in the sense that we often speak apples and the public speaks oranges. We don't do great at communicating our science in a way that is meaningful to the public. And so that's been something that people like me and others like me have been really trying to cross that bridge. And it's sometimes with success, sometimes without. What I think is important is that we be as genuine as we can as scientists and medical professionals. We admit when we don't know things, and say that, like Dr. Hawkinson said, it remains to be seen about some of these things, right? We don't have the data. But as much as we can to encourage people to make data-driven decisions in every aspect of their life. You look at the forecast before you decide whether to bring a raincoat or an umbrella to work that day. This is really kind of the same thing. We want to encourage people to make evidence-based decisions whenever they can. And so as far as those tougher conversations, we're not going to win all of them. But I think it's important to not give up, and it's important to, again, try to establish that rapport and trust, because people aren't going to listen to you if you're yelling at them.
Right.
And so I think that has been something that I've been really trying to remind my colleagues about as much as possible.
Not always easy to do. Promise me this, though, until we get across the finish line, you'll keep coming back here.
Absolutely.
And sharing your information. We really appreciate you. I want to get to our final thoughts, and I want to start with you. What do you want our takeaway to be today?
Oh, goodness. Don't take COVID with you with the mashed potatoes when you go to Thanksgiving this year, please.
Well said, yes.
Make good decisions.
Make good decisions. Thank you so much. Dr. Hawkinson, final thoughts today?
Going to be a lot of news coming out later, probably from the FDA meeting today about the child vaccines, the pediatric vaccine for COVID-19. So I do expect that they will approve that, and then that will be one more step that they have gotten behind them to get it so that we can get the shots into the arms of those younger children.
All right, speaking of shots, you're getting yours tomorrow, by the way.
That's what I heard.
You're ready? Don't squirm away. Okay, so thank you all for being with us. And you do not want to miss tomorrow. It's Open Mics with Dr. Stites. Yes, he and Dr. Hawkinson are going to roll up their sleeves, get their flu shots live right here on the show. why it's so important that you get yours this year. Every year, but this year for sure. Also, Heart to Heart International is going to be here, Children's Mercy, and Come Back KC. They are all joining us, so it's going to be a packed show, all sorts of good stuff. So we will see you tomorrow right here at 8 a.m. And don't forget to watch us anytime by going to Facebook and YouTube. Have a great day.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.